Micah Panzini, and I'm a respiratory therapist, and I'm the ventilation specialist with AeroCare.
And I'm Zach Gantt. I'm with Encore Healthcare. I'm the CEO of Encore, and I'm also a respiratory therapist.
We wanted to speak to you today about AeroCare and our partnership with Nexus. AeroCare is a big company that provides big services through DME. We do anything from nebulizers to airvos and non-invasive and invasive ventilation.
AeroCare's got 300 locations. So the great thing about partnering with AeroCare means that your patients are taken care of anywhere in the country, but you've still got that small town feel.
Absolutely.
So the great thing about what we're doing here is we brought together what AeroCare already offers, which is great respiratory care, in partnership to bring you the Nexus platform. And what that means is Nexus is all about outcomes, respiratory outcomes. And so Encore Healthcare is our company, and we only partner with the top respiratory companies in the country. So you know if our name is on it, then it is the top respiratory provider in the United States, and that's what AeroCare is. So they're one of the best, and that's why we partnered with them. And so the partnership means that we're bringing a disease management platform we believe is the future of home respiratory care to your patients. And so that means that every patient that gets enrolled in AeroCare's program, they're going to be provided a software platform, and that software is managed by a respiratory therapist. And we know, just like you guys, we're passionate about respiratory care. We're big advocates for our respiratory patients. And so using software means that we can help drive patients through a process where we're engaging them at a whole new level. And so that means we do something called dynamic dialogue, which is how we engage patients within the software. So any patient who gets enrolled in the program is getting engagement with respiratory therapists in the home. It's almost like a pulmonary rehab model. And so pulmonary rehab, as you know, a lot of patients don't want to go to pulmonary rehab because of the locations or because of the distance. So we're bringing that to them in the home.
So right now we have 9 respiratory therapists that are event trained. We get to go into homes with non-invasive, invasive, adults and peds, and not only manage the patients with pulmonary rehab, but also become their advocate in speaking with their doctors on how we can best improve their quality of life.
And we know that you guys are all patient advocates. I'm going to guess that probably nobody in that room or nobody that's with you right now got into respiratory care because of the money. You got into it because you wanted to change patients' lives. And so what I'll tell you is that what we're doing with the Nexus platform, what AeroCare is doing in the home with respiratory therapists is changing patients' lives. What that looks like is we've been able to reduce readmissions by 76%. So that's across the board. So what's that mean for you? That means that when you're in your job, whether it's in the hospital, whether it's in post-acute care, wherever you work at, you as a patient advocate, we're asking you to advocate for us because the best possible care your patient could get would be coming into AeroCare's program. And so we just ask you to consider us in the future.